Pueblo Community College's state-of-the-art nursing and allied health teaching and learning center, located on the St. Mary-Corwin Hospital campus, is a unique and innovative approach to addressing the region's healthcare needs. Once a functioning hospital wing, the tower has been converted into classrooms, learning labs, and study areas, allowing for simulated, real-world experiences as students learn and grow into highly skilled practitioners.
It has always been my vision that the Pueblo Community College student that is studying to be a nurse or in any of the allied health professions, they would get up in the morning, put their scrubs on, get in their car and drive to the hospital parking lot. They would walk through the door, smell the smells, hear the sounds, go to their classroom or to their lab or to the simulation center, and they would experience what they will experience once they have those competencies and they go out into the real world to work.
We had the entire East Tower sitting there, and the need was there, the opportunity was there. We sure didn't want to take the building down without looking at all options to utilize the space. So we have 6 floors of an actual hospital with a pharmacy lab and a surgical tech lab and everything that's needed to properly train hands-on experientially students for the healthcare field.
If you walk onto the 2nd floor, you will walk into what was the old ICU and where the nursing station is and the old patient rooms. Now there are vignettes in every single one of those rooms where students go from room to room and they are learning different skills. There's different scenarios that challenge them to be the best that they can be. When you walk down the Surg Tech Hall, you will actually see a simulated surgery center where the students are engaged in the surgeries, and it is absolutely amazing what the students are learning in this environment.
The classrooms that have been created, the situational labs that are there, has been incredible.
In order for our programs to grow, we need to be able to have clinical sites for our students to go in and practice. Specifically in the field of nursing, we are allowed to offer 50% of that clinical experience in a simulated setting. So by being able to create these simulation centers, our students can get the best of both worlds, really. They practice in a simulated setting, and then they go and work in hospitals and other private practices to continue to gain the skills that they need. Ultimately, what we want to be able to do is expand the number of students that graduate from Pueblo Community College that are available to work in our hospitals and all of the various practices of allied health that are necessary in a community that has an aging population, and quality health care is so terribly important.
According to Colorado Department of Labor data, Colorado needs to fill 4,000 registered nursing jobs each year, with the job market for healthcare practitioners and technicians expected to grow over 20% in the next decade.
It's going to add additional educational opportunities for those that may or may not have those in the southern part of the state. Having these educational opportunities, not just for those residents of the smaller rural communities, but also our own staff, people that work in the hospital right now, they can enhance and increase their educational benefits as well.
When we are able to expand our programs, we believe that we can add another 250 to 300 graduates a year and put them into the workforce. Where St. Mary-Corwin Hospital is located really gives us an opportunity to help the Bessemer community grow and rejuvenate itself back to the way it was at one point in time. We were so fortunate to have support from the federal EDA, the Pueblo Urban Renewal District. We have had support from the county commissioners. So this isn't just a private donor initiative. We have had city and county support, we've had state support, federal support. All of us collectively want to ensure that our community, the Pueblo community, continues to thrive and grow.
The Teaching and Learning Center comprises a total of 450,000 square feet, with only 60,000 now occupied by classrooms, labs, offices, student spaces, and even a daycare, leaving lots of opportunity to expand services and provide economic development with other partners.
I think this is a one-of-a-kind project. Let's just say a first-of-a-kind project, because there's a lot of hospitals throughout the country that are not being utilized right now, hospital space that either hasn't been maintained or looking to be raised. We found a different way to do that with Pueblo Community College and St. Mary-Corwin, Century Health, to find a way to build a long-term lease that will allow Pueblo Community College to raise the funds necessary to convert this into a more livable, functional campus that is specializing in healthcare workers.
What sets Pueblo Community College apart is that it is not a building. We are teaching in a hospital setting.
Special thanks to Mike Cafaso, Centura Health, the PCC Foundation, and all the private and public donors and faculty and staff who made this teaching and learning center possible.